Hello, friends, and welcome back to Beyond the Dental Chair. I'm your host, Brittany Murphy, the myohygienist, your guide to thinking outside the box, expanding your skill set, and making a bigger impact on your patient's overall health. On today's episode, I want to tackle a skill that every myofunctional therapist needs, and that is the ability to clearly and confidently explain what it is we actually do. If you've ever struggled to articulate what myofunctional therapy is in a way that resonates with different audiences, then this episode is for you. I want to walk you through exactly how you can craft your own elevator pitch, what key points you should include, and I'll even give you some tailored examples of different examples of verbiage you can use with different professionals, whether it's a dentist, speech therapist, orthodontist, ENT, or even a complete stranger, literally on an elevator. So by the end of this episode, you're going to have a pitch that you can confidently use in any conversation so that you can continue educating, inspiring, and growing your practice. So let's get into it. First, let's just talk about why an elevator pitch matters. So, an elevator pitch, first off, it's a short, compelling summary of what it is that you do and why exactly it matters. And it should be delivered in a time that it takes to literally ride an elevator. So, roughly like 30 to 60 seconds. And the goal, we really want to grab the attention of the person we're speaking with, right? Spark some interest and really leave the listener wanting to learn more, wanting to take that next actionable step. As myofunctional therapists, we know that our work is incredibly important, but the challenge often is making others understand the value quickly and effectively. So that's why having this well-crafted pitch tailored to different audiences is extremely crucial and beneficial. A successful elevator pitch should clearly define what myofunctional therapy is, but you want to avoid jargon and you want to make it relatable. You want to highlight the benefits, explain why it matters, not just what it is. You want to tailor it to your audience. So, speak their lingo and connect with whatever their needs are, what their pain points are. Keep it concise, keep it engaging. You really want to intrigue whoever your audience is. You absolutely, under any circumstances, do not want to overwhelm them. So be very careful with that. And then you always want to end with a call to action. So give them a reason to continue that conversation. So let's talk about how we can kind of put this into practice. So I kind of just developed a few different example verbiages. I wanted to put them like literally on the screen for you guys so you can, take screenshots, read them over. Obviously, craft it into how you would speak, right? You don't want to completely change the way you speak to somebody. I usually say, like, pretend you're having this conversation with whoever that person is, like at your, kitchen table or your island, and keep it more informative, casual, but educational and informative, right? So, an example for an elevator pitch for a dentist, you can say something like, "Hi, Dr. Tooth. I'm Brittany Murphy. I'm a registered dental hygienist and a myofunctional therapist. I work with patients who have oral dysfunctions impacting their dental and overall health, such as tongue thrust, mouth breathing, and TMJ issues. Myofunctional therapy can really enhance your dental treatments by improving muscle function, stabilizing orthodontic treatment and other dental work, and supporting airway health. I'd really love to collaborate and discuss how we can work together." Another example, you can say something like, "As a myofunctional therapist, I work alongside dental professionals every day to address oral dysfunctions that impact occlusion, impact airway health, growth and development, and really just overall patient outcomes. What I focus on is correcting tongue posture, breathing patterns, and muscle function to create that stability for orthodontic work and other long-term dental health." So by integrating myofunctional therapy into your practice, you will be able to see improved treatment outcomes, better retention for your orthodontic cases, and even long-lasting functional improvements for your patient's overall health. We don't just want to focus on those dental benefits. When I look at a patient, I'm looking at their whole body. So we're really providing that comprehensive care. Okay, moving on. An example of an elevator pitch for a speech therapist. So, "Hi, Miss Speech Therapist. I'm Brittany Murphy, a dental hygienist and myofunctional therapist. I specialize in retraining oral and facial muscles to support optimal function, which can complement your speech therapy work. Many articulation and swallowing issues stem from poor oral muscle coordination, and my therapy helps to enhance speech outcomes by addressing the root cause. So let's chat a little bit more about how we can collaborate for better patient success on both our ends, right? You always want to keep it a two-way street. Another example can be something like, again, introduce yourself. Hi, my name's Brittany. I'm a registered dental hygienist and myofunctional therapist. Myofunctional therapy really complements what you do as a speech therapist by addressing underlying muscle dysfunction in the tongue, the lips, and the jaw. So oftentimes, our work in tandem is really where we're going to see that better success. Many of your challenging speech cases, including lisps or articulation issues, are really tied to improper oral function. So, really, if we work together, we can ensure that these patients develop proper muscle control for both clear speech and overall oral facial health. And not only that, but this is going to help you progress your clients through your services much quicker, right? What is in it for them, right? They don't want to be seeing patients for years on end without any remediation. An example elevator pitch for an orthodontist. Hi, Dr. Ortho. I am Brittany Murphy, a myofunctional therapist. I help patients develop proper oral muscle function to support stable orthodontic outcomes. If oral habits like tongue thrusts or mouth breathing aren't addressed in your patients, relapse can occur post treatment, even with the use of retention devices. So, by collaborating, we can really help to improve your patient results and retention. I would love to discuss how we can integrate this therapy into your cases. Simple, right? Another example. Um, Hi, Dr. Ortho. Again, my name is Brittany Murphy. I'm a registered dental hygienist and myofunctional therapist. It's likely that you've seen cases where orthodontic treatment relapses, right? Or doesn't hold quite as expected, even if those patients are coming in and telling you that they have worn their retainer. And this is really where myofunctional therapy comes in. Our lips, our tongue are really like our body's own retention system, okay? That is our job. That is our job, or not our job. That is what the job of our oral facial muscles are. So by training the tongue and our oral facial muscles to function properly, we can address the root cause of why they started seeing you in the first place, of their malocclusion. And this is really going to help ensure a longer lasting orthodontic result and reduce the need for future corrections. It's an incredible, powerful tool to help stabilize your ortho cases. And I can't work without you because if I'm trying to teach the tongue to rest in the roof of the mouth, I need to know that there's enough real estate up there for that tongue posture to stay comfortably and functionally. Okay, two-way street. An example elevator pitch for ENTs. Hi, Dr. ENT. I'm Brittany Murphy, a myofunctional therapist. I work with patients struggling with airway issues all day long. That can be mouth breathing, and really any kind of tongue posture issue. My therapy supports nasal breathing and proper oral function, which often complements procedures like frenectomies and other nasal surgeries. Many patients need that muscle retraining for lasting results. We can remove the obstruction, but the body's not automatically going to go back to knowing what to do, especially if they haven't breathed correctly for, X amount of years that the patient is. So I would really love to collaborate and help optimize your patient outcomes. And really, I'm just trying to find that team of providers that I can refer my patients to because my job really can't be successful without you either. My patients need to be able to breathe through their nose in order for me to be successful. So I'd love to have, a team of airway focused ENTs to be able to refer my patients to. Two-way street. Another example. Okay, hi, doctor. My name's Brittany Murphy, myofunctional therapist. My job as a myofunctional therapist, I help patients optimize nasal breathing and tongue posture, and this directly impacts their airway health. Many patients that I see with sleep disordered breathing, mouth breathing, upper airway resistance, full blown sleep apnea, whatever that sleep disordered breathing issue is, or even chronic sinus issues, often have, almost always have, oral dysfunction that can be contributing to those symptoms. So, by working together, we can really help support these patients in achieving better breathing, sleep, and overall health. Very simple. Okay, we're literally in an elevator with a complete stranger and we start conversating. Hi, I'm Brittany. I'm a myofunctional therapist. They ask me what I do, which means I help people, right? What do? I help people improve how they breathe, chew, and swallow. Keep it simple, right? No jargon, no big words. We don't want to overwhelm them or completely lose their interest. A lot of common issues that we see, like snoring, TMJ pain, and even orthodontic problems, stem from improper muscle function in the mouth and face. And through my myofunctional therapy, I'm able to help retrain these muscles for better health and overall function. Another example, you can say, so I'm a myofunctional therapist. A lot of people don't know what that is. So, an easy way to think about me, I help people breathe, eat, and speak better by retraining the muscles of the face, the tongue, and the mouth. I know it's crazy, right? To think you're almost like you're going to be going to the gym for, your muscles in your mouth. But a lot of common issues that we see, I don't know if you know anybody, if your children or friends, any snore, maybe they mouth breathe or have gone through orthodontics time and time again. These are all tied back to improper oral function, improper use of these muscles here. And my work helps to focus on correcting these patterns to improve long-term health and wellness, right? Long-term, that is the thing. Retention and stability. That is what we really want to stress because it's true. If we don't correct that underlying muscle dysfunction, what's going to happen when you revisit these patients in a year, 5 years, 10 years? Okay, an example elevator pitch for referring a myofunctional therapist during a dental visit. You can say something like, I'm noticing some patterns that might be affecting your oral and overall health, like mouth breathing, tongue thrusting, or tight oral muscles. These habits can contribute to issues like crowded teeth, TMJ discomfort, and even issues like sleep disordered breathing, mouth breathing, snoring, of course, obstructive sleep apnea. Myofunctional therapy, it's kind of like physical therapy for your mouth. It helps to train the tongue, the lips, and the jaw to function properly. So I'd love to recommend a myofunctional therapist to you that's, local or that I know for an evaluation to see if this could benefit you. Would you be open to learning more? That way, this approach, it's going to keep it informative, relatable, and very solution focused, making it easier for the patient to say yes to a referral. Okay, we always want to keep it simple and relatable, right? Because if not, we are going to lose them. Another example, oh, my slides are going the wrong way. There we go. Another example, again, during that dental visit, you can say something like, during today's visit, I noticed that you have some signs that might indicate a need for a myofunctional therapist. And what they do is they focus on improving the function of your mouth and your face muscles. And it can help with issues that you're presenting with, like mouth breathing, improper swallowing patterns, and even your snoring. I'd like to refer you to a myofunctional therapist colleague of mine who can work with you on some exercises that can really help to better support not only your overall oral health, but your breathing and even your overall wellness. It's a very simple, non-invasive approach that can really complement your dental care. So, you can even use an example, whatever, dental treatment they're currently going through, whether it's, orthodontics, restorative dentistry, whatever it is, there is always a place for myofunctional therapy. But again, you want to keep this short and you want to highlight those benefits of myofunctional therapy while focusing on how it's going to enhance whatever symptom that patient is presenting with. Another example, I've noticed that you've been dealing with whatever that specific patient's pain point is, whether it be jaw pain, headaches, neck discomfort. And it really could be related to the way your muscles are functioning in your mouth and face. I know that's crazy to think about. I feel like we never think about what our mouth is doing, right? We know we go to the gym and we work out all our other muscles, but why would our mouth muscles be any different? And that's where a myofunctional therapist can really help guide you through some simple exercises to improve muscle balance. Again, we're working as myofunctional therapists below the eyes and above the shoulders, reducing any tension and potentially relieving some of that discomfort. It's a non-invasive way to address the root cause and help you just feel better on a day to day. I would be happy to connect you with a therapist who specializes in this. Okay. We're targeting a common concern that we see in patients, right? How often do we see jaw pain, headaches, neck discomfort? And showing how myofunctional therapy can be a solution to X, Y, and Z pain point. So now that you've seen some of these tailored pitches, here are a few tips to ensure that you deliver them effectively. So I definitely recommend practicing. I mean, you don't want it to sound rehearsed. You want your pitch to feel, natural, again, like a conversation, like I'm sitting here talking to you at my kitchen table. Um, you want to be confident and keep it engaging. And I feel like practicing your pitch does help bring that confidence because you're always going to have like those certain little phrases that you go back to. And then you kind of change it based on who it is that you're talking to, right? So keeping it confident, or I'm sorry, being confident is going to really show also that you value your work, right? And just that energy, what word am I looking for? Contagious energy, that passionate energy that you exude makes people want to hear more. Oftentimes I hear that from people, and I think part of it is the way I like my whole body talks when I talk, like my body moves, my hands move, my head moves. I don't know if that has anything to do with my dance background, probably more so to do with my Italian background, just always talking with my hands. My eyes are get really big, but you can just see all of this passion that I have. And it really helps keeping whoever I'm talking to very engaged. And you can see even just like the shift in like the tone of my voice and things like that, right? Like high pitch, low pitch. You don't want to be what word am I looking for? Monotone, right? Who wants to listen to somebody monotone? Not me. Okay. So again, be confident, be engaging. Remember, as always, the work that we do truly, truly makes a difference. And then take that practiced or rehearsed elevator pitch and just adapt it based on whatever conversation you're having with somebody. And if they seem interested, continue expanding. If not, keep it very short and keep it very sweet. Okay. But at the end, you always, always, always want to end with the next step. So ask if they'd like to learn more or, offer to collaborate if you're speaking with a other healthcare professional that you're trying to bring onto your team. So I hope that this was helpful. I hope that I, provided you with some tools that you can utilize to confidently explain what it is that we do and how myofunctional therapy can benefit different professionals or different patients or clients. So remember, your elevator pitch, it is your key to making an impact, a lasting impact to your growing practice, your growing audience, whether we're talking about social media and getting more present on social media, whatever it might be. So practice makes perfect, guys. Start practicing, refining it. You'll find the more that you have these conversations, the more you're going to fine tune it. And you can literally talk to anybody, anywhere, at any point, exactly delivering the message about what it is you do and how it can be helpful to them, regardless of what they're presenting with. So if you enjoyed this episode, be sure to not describe, subscribe. Leave a review, please, and share it with other professionals who are really interested in diving into the world of myofunctional therapy. You can also connect with me through my social media page, through my website, email. If you want to keep the conversation going, have other questions, as always, definitely reach out with topic suggestions. We started with a big laundry list, and I've been, going through them one by one. So I'll be putting a social media post out there again for any topic suggestions. I mean, I have topic suggestions, but I want to make this useful for what you guys want to know. So reach out to me. And until next time, let's keep thinking beyond the dental chair. Take care and keep inspiring.